Hey guys, I'm Michael Allen for Travel Costa Rica NOW.com, and do we have a good video for you today? We're going to be talking about medical tourism. And what you need to know, if you don't, Costa Rica is definitely on the map when it comes to medical tourism. And I'm talking all medical tourism. I'm talking you need implants or things with your mouth or dental or back surgery or stem cell replacement, all those things. And we're going to be talking to Johnny, who is a very knowledgeable in this field. And the thing before we talk to Johnny, I want to say one more thing. You guys know how hard it is to find somebody that you can trust with things. It's like that way with an attorney. It's like that way with a real estate agent. And it's definitely like that with your body, your medical. Johnny was not easy to find. I trust him. The reason I'm telling you about him is because I would trust him with my mom, my family, finding me a good doctor. So we're going to talk to somebody who knows about medical tourism down here, and it's his business to know things that you may not be able to find out. So, Johnny, thank you so much for coming.
Thanks for having me.
You can't wear the mask because they need to see your face, because they may not trust you wearing the mask.
All right.
Now, just so we're all clear, we both got tested for COVID, and we're clear. So
we're good to go.
We don't need those comments. All right, Johnny, so let's start out with Costa Rica has become a very popular place in the last, 5 to 10 years in almost all aspects of medical tourism.
There are a lot of categories. Big categories, been dental.
Yes. Well, even me. You guys, if you've seen any of my older videos, Johnny hooked me up with my braces. I had my braces from the beginning of my braces to the end of my braces, everything, $720.
Yep.
Beat that. So yeah, dental's one aspect. So what are some of the other bigger categories? I heard a lot about back surgery.
Back surgery, hip surgery, stem cell treatments, 115 different specialties. So take your choice. But everybody's specialized in a certain area. Everybody helps you. But the most important thing is that it's safe.
Now, I was telling them, because they're obviously not really sure, what do you do? So if somebody writes me and go, Mike, I'm looking for stem cell surgery or replacement down in Costa Rica, and I'm going to say, I'm going to send you to my guy Johnny who can help you. What are you going to do? What can you do?
Well, first I'm going to listen to you. And then I'm going to take what you tell me, and I'm going to take that and match you with somebody that will work with you, that will make sure that this is a right fit. Because you could have 100 dentists or 100 surgeons, but there's got to be a right fit.
Right. Now, you were telling me before we started, I actually knew this before, you've actually vetted the Costa Rica medical field, the doctors, who's good, who's bad, who you shouldn't use, who's got this, who's got that kind of.
Correct. We vetted everybody that we use, and we vetted people that we won't use. There's also, like in your videos, the good and bad. There's also the good and bad. That's why we come into play to give you that confidence when you come here, that the professional that's taking care of you is not only professionally capable of doing it, but also he or she has insurance. It's not common in Costa Rica about malpractice insurance. So if something were to happen, we're here to make sure that you're taken care of.
So malpractice insurance isn't a requirement for a doctor here necessarily?
Not necessarily.
And you may or may not know that, but you should probably know that, right?
You should definitely know that. You're in a foreign country. You need to know that the professionals taking care of you. Do they have any malpractice suits? Do they have anything going on? Has it happened in the past?
You don't always find that on the internet.
No, you're going to get a referral. You're going to get a good testimonial. I go to their medical records here on their practices and their career.
So basically, a lot of people, and I would probably be in this position if I didn't live here in Costa Rica. I'd be a little bit uncomfortable coming to a country that I don't live in, foreign. Will you, I don't want to say handhold because that sounds, but would you, how much are you in, can you be involved or not be involved in me coming down here to get stem cells. Okay, you already helped me with my doctor. Thank you. But what else? Can you do anything else?
Well, we do a lot of things. We can take care of you from the time that you step off the airplane to your hotel, to the transportation, to get to the doctor, to get you back, and get you back to the country from origin. So that, or we can simply make sure that your appointment's set up, that people are picking you up on time, that you're being greeted at the airport. Or we can simply do an appointment. It's all up to you.
Now, I know this always comes up because it's already come up before. Everybody goes, well, it's cheaper somewhere else. And obviously it can be cheaper somewhere else. It could be cheaper in Vietnam. It might be cheaper in Mexico for different reasons. So I don't want anybody to mistake that we're trying to say Costa Rica is the cheapest in the world to come down. But I think there would be a lot of reasons why people pick where they pick, right? So price-wise, first of all, what would be like, just in general, a price difference between doing some sort of backs or something, the price between the United States and Costa Rica?
Well, let's take price for a second. Price versus cost. If something goes wrong, how much is it going to cost you to fix it? So price sometimes is relevant when you're doing something abroad, but especially if you're doing something very, very invasive, price should be the secondary. Should know that the professional that's doing it is adequate enough to finish the job, but also you're not getting into trouble. And if you want to go price-wise, there's other countries that are less expensive, but we've all had those experiences where price has been the last thing that
you get what you pay for.
Correct.
There would be nothing worse than going to get some serious surgery in like Vietnam, be on the 17-hour plane ride back, and go, oh my God, I think something's wrong.
Yeah.
I'm not saying Vietnam. I didn't mean to say Vietnam is not the place to go, but I think one of the big draws to me would be Costa Rica, is just for the fact that it's kind of a beautiful country. Again, not that others aren't beautiful, and kind of semi-close to the United States, which is nice. So,
well, we take these other countries, and they have a lot of good professionals around the world. But what we're offering is something unique, personalized here in Costa Rica that takes care of you. And that's what you want. Sometimes I'm from California, so a lot of times I put my health care at the back burner, and you pay for it in the future. So it's more of along lines of, you want to take care of yourself, give us an opportunity to show that we can.
Well, my thing with you is, finding you, I think, was important because you know the United States, you speak English, and you definitely know Costa Rica. Your family is here, all that is here. And, you vetted doctors, and you're just, why do I want to mess around too much on things I may or may not know? The internet can be true. There can be false information. That's comforting me. We're talking about body. We're talking about people's, your health and body. I do want to go back real quick to the price, because so if something was, I don't know, what should we use? Dental implants? If something was $20,000 in the United States, about how much would it be here in general?
It varies from 50 to 70%, depending on where you go, the professional that's doing it. But that's about the price range that you're going to save. Sometimes in other treatments, you may pay a little bit less of a discount, but the personalized doctor experience, that sometimes these doctors will give you their personal numbers. Who does it?
Nobody. But I think, but the draw is, most people, it's either they're coming down here, they don't, they are looking for a more cost-effective way maybe to fix their back, to fix their mouth, stem cell, whatever it is. Obviously, cost, maybe they don't have, insurance doesn't cover it, they only have so much cash. So I was just trying to get a thing if, generally Costa Rica is going to be quite a bit. My braces, somebody just wrote me yesterday. They said, I got my Insuline braces in New York, $5,000 out of pocket cash, and I paid $750 for my whole everything, visits, braces, everything. There's kind of a difference.
There's a big gaps on pricing, but I guess price, at least for me, it's the patient experience. It's that you're happy with what you get, and then price the price comes in naturally. So you're always going to save. It's just how much it varies, but we do our best to align you with people an affordable but quality service.
Can you think of anything that people, let's say Costa Rica's not their thing, what would be a couple things that you can think of that they might be aware of if they're going to do something pretty big in outside of their home country? Is there, like, I don't know, rating the dog? What should you be looking for? What are some of the pitfalls of doing this, like going out of country?
Distance. If you're going to choose, whether you choose us or somebody else, distance, time for healing, chances for an infection, things like this.
If you have to run back,
run back and forth, or even if you're in country, sometimes people, I'll give you an example, people want to do implants. Sometimes, well, I can get in this weekend and I can do the implants, but what happens is sometimes infections don't set in until 3 or 4 days after your implant. And if you're out of country, now you have a problem outside country when you try to save money. Spend a little bit more time on your health vacation, take care of yourself, and give yourself time so if an infection does happen, that you give your physician an adequate amount of time to fix the problem.
I just like the fact that you've answered the questions for people that they don't even think of asking. Like maybe they don't know about the quality of certain things that somebody's using in their mouth. Well, you vetted the doctor to make sure that people are getting what they pay for and getting what, you know what I mean? It's like a lot of people don't know, like malpractice insurance, another good example. They may not even know to ask that question in a sense. They might just assume that, everyone's probably got insurance for this or that, when that may not be true.
Right. A lot of people base a lot of things on referrals. Referrals are important, but understanding the background of the professional that's taking care of you is also important. Whether you choose us or somebody else, understanding that is always important. But you have to get that all the time.
I think the other interesting thing we've talked about is, I've lived here 15 years, and every gringo that lives here, the only hospital they seem to talk about is SEMA. It kind of seems to be like the gringo hospital. But yet you work with hospitals that are just, not that SEMA's anything wrong with SEMA, but there's other hospitals as good, sometimes better in certain aspects that they don't even, and might be even a little more cost effective than SEMA for certain things. And you can even direct people, right? Is this true?
Correct. There's 5 private hospitals in Costa Rica. SEMA is a quality facility, but there's also other choices. There's actually the largest private hospital is La Biblica, which is...
Biblica.
La Biblica,
Yeah.
yes. They are the largest, and they have a lot of specialties. They have one of the greatest amount of specialties in Costa Rica.
Wow. See, I knew about them because, I live here, but we just always, SEMA, go to SEMA. And, it's, I don't know. I'm not saying it's bad. I'm just saying it tends to be more on the expensive side.
It was catered a lot to the Americans, but they're a very good hospital. But
not the only alternative, I guess, is what I'm kind of saying. There's other ones too.
Correct. I give you a choice of 5 hospitals. You have La Biblica, you have La Católica, Metropolitana, and you have SEMA, and you have other smaller hospitals dispersed out through the country.
Now, are you using? Do you just do San Jose? You know what I mean? Like, or are you familiar with if somebody, I don't know, wanted to vacation on another part of Costa Rica? Are you familiar with the country and the whole medical?
Yes, we are.
Sorry.
But what you're going to find is that we're going to be very transparent. There's other facilities throughout the country, but what you're going to run into is that the professionals and the amount of equipment sometimes doesn't always exist in the outskirts of the country. The greater technology, the bigger technology is rather in the GAM area, more metropolitan area.
Where you would think it would be, kind of, I guess, right?
Correct, yeah. So depending on your procedure, you can go vet out a little bit out in the outskirts, but I suggest you stay farther inland, Central Valley, to get certain things done.
Well, here's the thing, guys. If you're interested, you're thinking about Costa Rica, you got something major to do maybe. Again, stem cell, mouth is the big one, seems to be big time mouth stuff or whatever, back surgery, and you have some questions, might be a good place to start. I don't know. But again, there is other places. I'm not trying to promote anything or anybody really. I just try to give you information, solid information, and trusted advice, because you're not easy to find, Johnny. You're not easy to find. You know what I mean?
Yeah, we try to stay busy, but we try to stay very fair but personalized with our patients.
Well, Johnny, thank you so much. We might talk again, because I'm sure we'll have some other more personalized questions, something to do with health, I'm sure.
Well, thanks for having me.
Thanks a lot. Anyway, guys, I'm Michael Allen, TravelCostaRicaNow.com. Peace, guys. I know that helped. You can't even say it didn't help. I know it helped. You can put on your mask now.
Thanks.